Right now, presidential hopeful Senator Bernie Sanders remains in the hospital following heart surgery. His campaign manager says he experienced chest pains last night and was rushed to surgery. He had to have 2 stents placed for blockages in his artery, and he's expected to make a full recovery and get back on the campaign trail. Joining us right now is Dr. Rahul Agarwal, a cardiologist at Palm Beach Gardens Medical Center. Thanks for joining us, Doctor.
My pleasure.
Now, this is not that uncommon for people. You get a stent because you have a blockage, right?
That's right.
How does that stent open it up?
Right. So if you imagine an artery and you place a wire down the artery, it acts like a railroad track. And on top of that, you put a balloon. The balloon is hollow and it rides on that railroad track. We inflate the balloon and it squishes the plaque to the sides. The stent looks like a pen spring, very complicated architecture, but it's crimped onto a balloon. You ride that on that railroad track, you inflate it, the stent deploys and pushes all the plaque away and keeps that artery open. The recovery time is very quick. Usually a patient will stay in the hospital overnight. If they've had a heart attack, they may stay another day or two. And usually they're back fully functioning within a week.
I think that's the big question right now is Bernie Sanders put his campaign on hold for now, but not dropping out just yet. So there's a really good chance in a week or so he's back to what, a 90%?
100%.
Wow. That's quite...
That is incredible. And there's no lingering, problems. He just has to have a checkup, right?
Just has to have a checkup, make sure he stays on the medications to keep the stent open, clean diet, and keep the stress down.
Yeah, we were talking a little bit earlier about this almost seems like an outpatient type of thing. It used to be a much bigger process, correct?
That's right. The technology has advanced so much, and the equipment has gotten so much smaller, and the medications have gotten so much better that now it's routine.
So, and it's not like open heart surgery, because you said the entry is, through an artery at the wrist or the groin?
That's right.
Okay.
So Bernie Sanders, 78 years old, possible for him just to jump right back into things, it seems like, based on what you've told us.
And he didn't necessarily have a heart attack, correct? It's possible to have a blockage and not have a heart attack.
Correct. You can have what we call angina, or just unstable angina, where they get chest pain, but there's been no evidence of damage.
That's great.
Yeah.
All right, Dr. Agarwal, thank you so much for joining us today.
My pleasure.